Hi everybody, today I want to go over some techniques for massaging C-section scars. This is often an area that gets neglected, and you can work on these areas even if it's been years after your C-section. But it's not uncommon that I see women that have never worked on their C-section scars, and that area can still be causing pain. It can be causing discomfort when they wear like leggings or jeans, or it might be inhibiting them when they exercise. That scar tissue could be stopping the abdominal muscles from contracting correctly, and then it feels like they can't get the stability that they need in their core. So I'm going to go over some techniques with you. All right, so if this were my scar, you can start working on your C-section scar about 6 weeks after. And what you want to start with is just working around the scar to start. So you can just do little circles, and you can kind of tack down other areas, and you want to work all the way around. I would aim for working on your C-section scar for about 10 to 15 minutes daily if you can. And it might cause a little bit of discomfort, a little burning sensation, and you want to continue that pattern. So circles are one technique that you can use. You can also go back and forth and do that, working on the scar. And then you can also do up and down techniques. So circles, back and forth, up and down, working all around the scar. You might want to spend a little bit more time on areas that feel really tacky, like you feel like you can't glide the tissue very well. Other techniques that you want to do to try to desensitize this area is using like a towel, or you could use a soft blanket or maybe a soft hairbrush, but you can just do the same techniques with the towel, just working around that scar, little circles, little back and forth, just working all the way around, again focusing on any little spots that feel sticky. And this is a nice, working with a towel, this is something you could do daily when you get out of the shower, just spending a little bit of time working on the scar and getting it moving and getting it desensitized, getting it used to touch. Or you might maybe like you can spend a little time working on it before you go to bed at night, or maybe if you have a little bit of time early in the morning. So first 6 weeks, we want to work on just getting the tissue around the scar. After the first 6 weeks, getting the tissue around the scar moving and working on desensitizing with different materials, towels, things that are soft, and then you can work to more harsher materials, like if you ever want to use like wool or anything like that. Just stay away from anything sharp. And when we're doing all of these techniques, no lotion. You want to have that like tackiness between your fingertips and your skin. So no lotion when we're doing these techniques. After 12 weeks, you can start working into more direct scar tissue mobilization. And so that's when we're going to work directly right over the scar. So again, it's just going up and down, and you can kind of tack one end and work across the whole scar, moving up and down. You can then also do diagonals across the scar, getting that tissue to glide and move. If there's like any spot that doesn't feel like it's moving, you could even hold it there. So allow yourself to kind of play. Again, like feeling a little bit of burning, a little bit of discomfort, that stretch feeling, that's okay. Diagonals, up and down, circles. You can also change your pressure. So I might start with like a lighter pressure, and then I can kind of press more firmly into my tissue and go a little bit deeper. Another technique that you can use is you can do an abdominal brace and then do the scar tissue mobilization, and that might help break that scar tissue up a little bit more. So that would be doing our inhale, exhale, tightening my core, holding that abdominal brace, and then going in there and doing that back and forth, side to side, circles, all around my scar tissue. And if you think about it, then you're killing two birds with one stone, right? You're working on your core muscles, and you're also working on your scar tissue. So that's awesome. One final technique I want to show you for working on the scar directly is what we call a skin rolling technique. So if I am trying to pick up the skin and then I'm rolling across, you can see I have a little bit of tightness in the middle there. So again, I use my thumb and like my index finger. You can sometimes use middle finger too, but just kind of like walking. There we go, get it a little bit more across that area. And if you have an area that doesn't want to move as much, you could focus a little bit of time there. So kind of picking that up and then trying to move it side to side, up and down, diagonals, getting that tissue to move. And again, spending a little bit more time on areas that feel a little bit more tacky. So hope that helps. Let me know if you have any questions, but caring for your C-section scar is very important. Again, you can do it even if it's been years after your C-section. And I think just loving this area, because I have so many patients that really have a hard time giving their C-section scar attention, whether it's kind of trauma from delivery and having an unexpected emergency C-section. But one of my colleagues once said to me, how can you heal a part of your body if you hate it? And so just reintroducing touch, love, and acceptance to the area in due time, so that your abdominal wall can feel healthy and feel good.